Hey everyone, welcome back. This is the Tinnitus Virtual Summit 2020. My name is Dr. Ben, your host. We're here today with Steve Eagon. Steve is an audiologist and head of sales development at Eargo. Steve has 30 years experience as an audiologist, and he's here today to share some perspectives about tinnitus, hearing loss, and hearing devices. So Steve, I want to ask you, how have you seen COVID-19 affect the audiology and tinnitus communities?
Well, first, Ben, thanks for inviting me to be a part of this. This is truly something unique and valuable that you're giving to consumers out there. So commend you for putting this together. What I've seen, as far as like what our company has seen as far as COVID, so much of tinnitus, I think that we all know for the years that I've been doing this is related to stress. That's a huge underlying component that makes it, worse for some people more so than others, is that we're seeing in some instances COVID has created more stress in people, thereby increasing tinnitus, I think perceptually. But one of the other things that we're noticing too, and I was interviewed for this yesterday, is that by wearing masks, people with hearing loss are also noticing that it's more difficult to follow conversations. They're losing the context of lip reading, speech reading, whatever we're calling it, and because of the masks, and therefore increasing a little bit more stress and anxiety, and we're hearing things like that, and therefore, the tinnitus is kind of, ratcheted itself up perceptually for the consumer a little bit. So those are some things that we're hearing.
Mm. And a lot of our viewers are likely to have hearing loss in addition to tinnitus, and they may have seen advertisements for hearing aids being sold on the internet. What do our viewers have to know if they're considering moving forward with hearing aids?
Well, I'd like to think I have a decent amount of experience in this area. I have worked, in addition to Eargo, I've worked for another company that was working with consumers with hooking them up with hearing professionals around the country back starting in 2000. So for the last 20 years, I have been kind of living in this internet world of customer experience and helping people purchase hearing aids and so forth. There is a lot out there. There's no question. And I think in the age that we're in today, with over-the-counter regulations coming into play, there's a lot of very cheap and expensive amplifiers. There's not a lot of regulation that we're seeing online. So you do have to be very careful. There's a gentleman online by the name of Dr. Cliff who does a really good job of reviewing and talking about different types of hearing aids that are available online, and you can research some of his. He has one episode on how, what are some things to look for and trust. I think bottom line, as a consumer, when you do your homework, there's a very sharp division between what is a basic amplifier that could be $100 or $150 or even less. And then you've got some companies that are bridging between that and a hearing aid. And then you have a company like Eargo, who I work for, that is kind of a hybrid of everything. So we're a direct-to-consumer model, but we're also a Class 1 FDA registered hearing device. And we provide audiological support to people pre-purchase and post-purchase as part of the model. So, you do have to do your homework. And I know price is a consideration and convenience is a consideration, but you have to be very leery, to me, of promises that are just too good to be true. And I've seen way too many instances online of companies advertising themselves as a hearing aid, promising 100% tinnitus relief. And we all know that that's just not possible with any hearing aid, including Eargo, what we offer. So there's a lot out there. Would you like me to expand on anything or?
Yeah, I would like you to expand on the experience of someone who has tinnitus right now, who hasn't ever worn a hearing aid, but they're noticing some extra difficulties, maybe now when everyone's covering their face during COVID-19 with masks. And could you walk us through what that typical experience would be like for someone who's watching, who maybe hasn't considered it, but knows they probably should think about it soon?
Yeah, I think that if you're noticing an increase of stress because of COVID and the masks, and if you already know that or are strongly suspecting that you have tinnitus, there are some pretty good online hearing tests out there, and that's a lot of times I like people to start with a hearing check or something to give yourself, an idea that's a confirmation that I may have hearing loss. And a lot of, to me, reducing stress, reducing the anxiety of tinnitus and hearing loss is to begin educating yourself and realizing that, hey, I'm not in this alone, right? There's other people, there's millions of other people out there like me that have hearing loss, that have ringing in the ears or buzzing or crickets, whatever, however we want to label tinnitus. And there's a lot of really good ones. We use at Eargo, we use a hearing and noise test that's on the World Health Organization's website. And you listen through headphones and you can respond by repeating digits back on the computer screen. And we label the person and the outcome. We put you into 5 categories depending on the statistics that that this particular screener developed by a company in Europe has put together. To me, that's always a good start, is to get a hearing check and then talking with somebody. The experts that we employ, we have a full team of audiologists, and we have people that are highly skilled at asking the right questions just to assess, to see where you are. And as part of that assessment, yes, we get into a tinnitus discussion if the person brings it up, or if we're going through some of the FDA disclosures and having a discussion about that, and when it comes up, and then we kind of move from there. With COVID, I think we just have to be prepared in knowing that when we put a mask on, that if we have hearing loss, that communication and understanding those nuances of speech, those high frequency consonant sounds like STH, SH, those sounds become even more muffled and difficult to hear.
Thank you for sharing that. And for anyone listening who may not already know, a large percentage, around 80% of people with tinnitus have some degree of hearing loss. And for those who have hearing loss, they would see an audiologist or they would get a hearing test elsewhere. And there would likely be a discussion of, is now the right time for you to try hearing aids? And for someone to be in that position, they would ask themselves, okay, where am I having trouble? Is now the right time for me to try to see if I could hear better, to communicate more easily? And a lot of people watching this are watching our summit because they have bothersome tinnitus. So there was a survey around 5 years ago that was from audiology providers, and that survey reported that around 60% of people with bothersome tinnitus who tried hearing aids did report some relief from the hearing aids during the day while they were wearing them. I know that you had brought some Eargo devices, and for anyone who doesn't know, Eargo is a type of hearing aid. So Steve, would you be willing to show us the devices and a little bit about a demo of in the ear, what would it do for the tinnitus and sound therapy and all that?
Sure. Absolutely. One thing that I'd like to mention is, to me, this was such an important thing to participate in, because I have tinnitus in both ears. I'm a semi-professional musician, and I've been playing, live music in bands ever since I've been a young kid, even preteen. And so from all the years of noise exposure and to this day playing in clubs, I feel like I can relate to a lot of the clients that we work with, and I train our staff, because of that, how I relate to that. And one of the things that I've personally found, and what drew me to Eargo, is, first of all, what I'm holding up here is this black device here. This is called our Pebble. It's our charger. And Eargo devices are sold direct to consumer. Again, they're Class 1 FDA devices. The lid comes off the charger, and inside you have, completely in the canal, devices that have these interesting tips to them. They're called, these are called tetrapalms, or flexi fibers. They've had a number of different names depending on the version of our hearing aids over the years. And what's unique about them, and this is one of the things that really drew me to Eargo, is that when I put in an occluding or an earplug in my ear that might protect me from noise exposure, or maybe sleeping plugs, my tinnitus gets noticeably louder. and that's that occlusion effect doesn't allow external noise to come in to mask that. But with an Eargo device, anecdotally, what we hear from, and we have heard for years from clients that purchase our devices, is that because they're able to fit into the ear canal to where they're virtually invisible. But the one piece about them that's interesting is that the flexi fibers on the tip, or these tetrapalms, are very soft medical grade silicone. So they allow the device to fit in the ear canal and conform to everybody's unique shape, but they leave the ear open. You cannot get occlusion effect with these devices. And I've got very small ear canals, so this was something that I figured if I could wear these comfortably, not get occlusion effect, then this should have a big impact for people. And so that's the device. And I don't want to go into too much of the details of it. If people are interested, they can always reach out and talk to us. But what we have found, Ben, is that over the years that I've been here, is that people, like you said, that do have hearing loss, that have tinnitus as well, report that by wearing devices that leave the canal open, such as ours, but also just provide amplification of not only speech, reducing some of the stress that the people encounter whenever they have difficulty hearing, but then by bringing in ambient noise as well, that tends to provide a masking effect, like you said, during the day when they wear them.
Yeah, thank you for explaining that. And it certainly is a unique product that you guys have. And when I first learned about the origin story, where I believe one of the founders was fly fishing, that's the story I heard, at least. They were fly fishing, and then the shape of the fly to the at the end of the hook it actually looks very similar to what the Eargo product ended up being. So I think that's pretty neat and cool. And thanks for sharing that for us. So your role with your company, Eargo, is that you're the head of sales development. And being an audiologist, that tells me that your opinion is really important in terms of creating the patient experience, and that means how much clinical care is there, how much attention to the audiology side of things, because a lot of hearing aids on the internet may not pay much attention to the knowledge that an audiologist knows, the psychological, emotional steps necessary for someone with hearing loss to actually continue with hearing aids. And I wanted to ask you, how does your company and how did you in your role take in mind the tinnitus patient and the specific goals and the needs that someone who has bothersome tinnitus would approach when they're considering buying Eargo hearing aids or any other hearing aids online? How did you make that work with your team?
So that's a great question. So we found that when you look at other direct-to-consumer models that are available online, if you simply are buying a hearing device, have it shipped to the home, it arrives, and you tell the person, good luck, you'll figure this out. I don't care how nice your instruction manual is. If you can't provide the type of coaching, setting of realistic expectations, you and I know, Ben, from both being audiologists, that so much of how someone successfully adapts to hearing aids, and then hopefully their tinnitus, they notice some improvement with that. There's a lot of psychology and coaching that goes along, and just really being somebody that's a motivator, a good listener, and that's also a key role that an audiologist plays. And what we've done at Eargo over the years is we provide a very thorough discussion with the client before there's even a purchase. We want to understand their hearing ability. Do they have tinnitus? Now, a lot of times, to be candid, is that we don't explore tinnitus with every single client that we talk to. We're talking with thousands of people every week. We will stop and explore it if it comes up either in an email, a phone inquiry, a chat, a text, anything that comes up, then we will prioritize that as part of the conversation. If somebody during the course of that initial dialogue and discovery conversation finds that the tinnitus is troublesome, that it's keeping them awake at night, it's disruptive in many facets of their everyday waking hours, then we will escalate that to one of our licensed hearing professionals on our team, who will then do a deeper dive with that client. in numerous cases over the time that I've been at Eargo, it is not uncommon for us to say to a client, going with a direct-to-consumer product like ours is most likely not the best thing for you, and we will then refer them to a local hearing professional in their case that's either has the experience for that face-to-face consultation and coaching. But we find it critical that yes, we are direct-to-consumer. We want to we want an easy to use product that's reducing stigma and making hearing care more accessible. But we also know there is a line that has to be drawn when we can't help somebody, either with the severity of hearing loss, the severity of tinnitus, balance disorders, you name it. We know when to draw the line on that.
Yeah, thank you for sharing that. And that's important. It's important for us as an overall community to
Of course.
be aware that most people with hearing loss have tinnitus, and a percentage of those with tinnitus are negatively affected by it. And if we don't ask, they might not share. So I'm glad to hear that you guys
Very
are
true.
with that. So I want to change the topic a little bit. What
Sure.
is something new that you've learned about hearing aids or tinnitus in the past few years? Does anything come up that you say, wow, that changed my perspective on hearing loss, hearing aids, or tinnitus?
Wow. Okay, so that's a great question. I don't think there's any one thing. Here's something that I think has come out of a lot of the focus groups that we do at Eargo, because we're always redesigning and retooling and planning for what's next. When I look back several years ago, when the industry really started exploding with Bluetooth streaming devices and connecting with remote controls, and you remember the lanyards people would wear around their neck to connect their Bluetooth devices. What we're finding with the focus groups that we do with Eargo is people really want simplicity. They want to be able to put a hearing device in their ear, and because we've toyed. I mean, as a company, we've sat down in meetings and we've had these long, drawn, drag out discussions and very heated debates about, do we make a larger device and put a Bluetooth receiver in there? Do we do a behind the ear model that can accommodate? And what we keep coming back to is our consumers are telling us, no, don't keep it small, because no matter how much we want to try and not talk about size of hearing devices, it is a barrier for thousands, if not millions, of people that are looking at getting hearing aids. So size does matter. People do prefer small devices. So we're kind of sticking to the less is more approach. So that's something that has surprised me, because when I look back several years ago and look at how that's changed, I see people getting away from wanting Bluetooth connectivity, remote controls, at least based on our own internal research. So that's one thing. And secondly, these really do help with tinnitus. I mean, leaving the ear canal open, anecdotally, we hear about it every day, but then again, focus groups tell us that as well. So
That's great. I like to hear about these. I like to hear about these focus groups, kind of like the insider knowledge.
Well, we have to. I think as a company, you have to do it. We have to talk to our customers, right? We have to understand why people don't purchase hearing aids and why people do purchase hearing aids. Personally, I learn more from why people don't. And it tells our marketing team how to communicate with them. It tells our sales and professional support group, how do we talk to people? How do we relate? What words do we use? I mean, it's just amazing. The psychology. Hearing aids is not about the product. To me, it never has been. The manufacturers probably wouldn't want to hear me say that. Our engineers probably wouldn't want me to say that at Eargo. But it really is about the customer and how they think about hearing aids and how they perceive them, whether or not they're going to wear them and get benefit from them. They don't do anybody any good, as you know, if they sit in a drawer.
That is true. I wanted to ask the next question for the audiology community. It's more of an industry-related question. So you describe Eargo as a direct-to-consumer model, and how does that relate to the developing over-the-counter hearing aid technology level and a service delivery model? How does that all relate and interplay with each other?
There's a lot that we don't know yet, because the FDA hasn't come out, with the guidelines. But that hasn't stopped. I mean, direct to consumer or mail order hearing aids have been around ever since I've been in the profession, like you said, for 30 years. Um, I think what we have to as an industry learn from what's coming and historically is that you can't, again, just think that you're going to ship a hearing aid to somebody's home and have it work. And the legacy of Eargo was way back, several years ago when Eargo started. Our business model was that. It was before I got there, but the business model was just to send the hearing aid to the home, and the person would do well, watch some videos that we had online. But you really do need audiological care. You need some type of hearing professional, whether it's a hearing instrument specialist or an audiologist, to move the person through, the adaptation and the knowledge of using hearing instruments successfully. So when I think of over the counter, I think that there's huge price differentiation, huge technology differentiation between what's offered. But then there's the huge support mechanism that a company has to build to be able to do this successfully, or you're just not going to have happy people out there.
Yeah, I know that COVID-19 slowed down the release date of many things. One of them being the over-the-counter hearing aid. And yeah, there's some speculation of how much will it really change the industry. My personal take is that there's a large number of people who could benefit from hearing aids, but whether it's due to price or the availability of services, they don't find that benefit. They don't get hearing aids. So
Sure.
that was the intention with the Over-the-Counter Hearing Aid Act, was to not take away from the audiology community and the service they're providing, but add a supplementary category of hearing aids. Right?
Yeah, I mean, that's what we see is that two-thirds of our clients that purchase Eargo are first-time users. We also have thousands of people every month that are inquiring about our devices, that like the information and they like what it's all about, but they would still prefer to go meet with somebody face to face. So there's plenty of room. Look, we're talking about an estimated 48 million people that have hearing loss. We all know the numbers. 25% are doing some. 25% of those people are actually wearing hearing devices successfully. So there's a lot of room for all of us to find a niche and grow this and help people hear better. So I don't see it being a detriment, because there's always going to be a place for Eargo. There's going to be a place for the $300 amplifier that's truly over the counter, and then there's going to be a huge place for the audiologist and the traditional channel.
Yeah, and let me ask you, what are the common misconceptions that an individual or a professional would have about Eargo or a similar direct-to-consumer online hearing aid model?
I mean, hands down, the biggest misconception about Eargo is that when you look at it, because it's direct to consumer, they think that the audiologist is being cut out. So the moment that they believe that the audiologist or a licensed hearing professional is being cut out of the picture, they assume that it's a, quote, over-the-counter or direct-to-consumer product. So that's the biggest misconception, is that we're kind of termed as an amplifier, when in fact, we're a 16-channel digital signal processor with 3 layers of noise reduction, dynamic feedback managers, and et cetera, et cetera. There's a number of things that are innovative, and to boot, it's rechargeable, and it runs 16 hours a day like clockwork. So that's the biggest misconception we have. And then the other one is the fact that people don't know that we offer, audiological support before, during, and then down the road, that anytime somebody owns. We have a very large team of hearing professionals that work for us.
Yeah, thanks for answering that. I find that there's a lot of benefit in sharing misconceptions one might have, because if I was a professional, like you said, that may be a reason why I put your company in a box as stay away. Or if I'm an individual interested in buying a hearing aid and I hear something about some company or some provider or individual, I just put it to the side. But to hear from the inside about what are these misconceptions from your perspective, it's a beneficial discourse. Thank you.
Yeah, absolutely.
Yeah. Well, we're wrapping up here. This is our interview with Steve Eagon, who is the head of sales development at Eargo, 30 years experience as an audiologist. And this is the Tinnitus Virtual Summit 2020. Steve, would you like to say any final words to our listeners?
Um, you know, the final words I have is that, as we talk to people during COVID, we're hearing some consumers that are saying, well, I'm not sure I'm that motivated to do anything right now because I'm not interacting in background noise and things. And, we can always try to find excuses as consumers not to do something that we don't want to do. But I feel that at this point in time, that if you have the opportunity to try hearing aids and work with friends and family, okay, and we're all around, especially close family more, they're the ones that notice our hearing loss. And if you have tinnitus as well, this is the perfect time because you have more time on your hands. You can work with your friends and family. You can experiment with coaching from a licensed hearing professional. I think this is an amazing time to be exploring hearing care and tinnitus management, personally.
Because it does take time. It does take time to learn a new system. It takes time for the brain to habituate and adjust. So with all this time many of us have during this pandemic, it may be the right time to move forward. Thanks so much, Steve, and thanks for everyone listening.
For having me.
Of course, this is the Tinnitus Virtual Summit 2020. Make sure you catch up our other interviews and presentations, which will be on Facebook Live as well as YouTube. Thanks, everyone. Take care of yourselves, and we'll see you real soon.